Hey folks, it's Beth Wright, and I'm here to provide you a podcast for Unit 3, Nursing 136, Chapter 29. And here we're going to talk about specific drugs to help nasal congestion and coughing and secretions, that kind of thing. So you're going to be talking about specific drugs here. Okay, so first let's talk about the common respiratory disorders, and we're talking about the common cold. So the common cold is typically a virus, and it can be 2 to 4 times a year for a typical adult, 10 occurrences per year for school children, or maybe even more. It's amazing when children start back to school in August. And boy, all of a sudden they start getting sick. So all those little germs spreading among each other. So we typically see that during those August months. Then they get a little better when they're out for Christmas break, and daggone, they get back into school in January and start getting sick again. So it's just one of those things. But viruses invade that mucous membrane, and they can survive. The viruses can survive several hours on the skin and hard surfaces. So hand washing, hand washing, hand washing. That is our best defense against infection. And of course, we should say proper hand washing. And also coughing and sneezing. When I was growing up, my mom would say, cover your mouth, and we did cover our mouth with our hands, but our hands are what we use to touch everything, and that's how it spreads. So there's a different way to cough and sneeze, and I have provided you some videos with that. And you probably have learned that as well. So we no longer use our hands. We use our sleeve or into our clothing, if you will, to do coughing and sneezing. So question for you, true or false? The common cold is caused by many bacteria, types of bacteria. Do, 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 do. Okay, you should have answered false there, because the common cold is a virus, not bacteria. Okay, so I got you a pictogram here of this poor man. So the question is it a cold or is it the flu? And so you see those signs and symptoms of a cold. Headache, normal temperature, slight aches and pains, sneezy, runny nose, sore throat, mild to moderate hacking cough. Versus, is it the flu? Yes, a big time headache, sudden onset of a temperature, and that's a high temperature, 102 to 104, severe aches and pains, extreme fatigue and weakness, severe cough, and chest discomfort as well. So you see he's got all kinds of little things there to help with treatment of that. He's got certain medicines he's holding, antihistamines, analgesics, nose drops, cough syrup, and analgesic antipyretic, which is a fever, meaning fever, versus the things that he's got on the floor there at his feet. So continuing on with common respiratory disorders, so the proper terminology is rhinosinusitis. Rhino, think about a rhinoceros. Rhino means your nose, and sinuses means your sinuses. So rhinosinusitis is involving your nose and your sinuses. So it's a cumulative thing with sinusitis, and it's inflammation of those paranasal sinuses. We've got those, when you see the word para, that means around. So around the nasal sinuses, around the nasal area there, and we get fluid and organisms movement via the cilia that's within your nasal area there. is impeded because of swelling. And so we got an inflammatory response that's happening here, and that's what causes that swelling and an increase of fluid and that kind of thing happening. And so we get an impairment of movement, which results in infection because those viruses are just, laying right there, okay? And they're in a nice warm environment, and then that can cause a sinusitis and lead to an infection. Rhinitis is where there's inflammation of that nasal mucosa. So notice we've used the word inflammation twice here. In that inflammatory response, you have many things that happen, and even though it is our body's defense mechanism when we have, when we're attacked by viruses and bacteria and that kind of thing, the inflammatory response is, causing some of our symptoms here, such as that swelling and that increase in secretions and things like that. So with the rhinitis, we have that inflammatory reaction happen with the nasal mucosa, and we can get symptoms such as purulent. Purulent means pus. It's a nice way to say it, better than pus, isn't it? So purulent, nasal drainage, and then we can have nasal obstructions. So we begin to sound all nasally when we get nasal obstruction, and we get congested. So think of the highway in Los Angeles, or sometimes even here at 5 o'clock, especially when we're coming home from work. Maybe the highway gets really congested and we can't move forward. Okay, same thing here. We get congestion in the nasal area, and then it causes the obstruction where we cannot have that drainage. It won't drain because it's all congested in there, and we can get facial pressure and pain. So the common signs and symptoms: nasal congestion, cough. Okay, so we can either have a productive cough, meaning that we're getting mucus out. Okay, anytime we have a productive cough, we want to ask the client, okay, what's the color? Anytime we have anything coming out of the body, we want to know the color, the amount, is there any odor, those kinds of things. But for cough, we want to know, is it productive versus non-productive? And if it's productive, we want to know the color of it. We want to know the amount of it, okay? Because the colors can mean something. A clear color, we're not worried about. Greenish, yellowish color, we're worried about, because a lot of times that means it is an infection. Okay, and then non-productive cough is where they're coughing but nothing's coming up. We don't have any kind of mucus coming up. And then we also have bronchial secretions. And that, of course, deals with the cough, a productive cough. Okay, so let's talk about the nasal decongestions. You have a list of them on table 29.2 there. And our prototype here, I should have put that on the slide, but you write it in. Our prototype is pseudoephedrine. And that's like our Sudafed, Dynatap. Those are your medicines that you probably have heard. A lot of these are over the counter. So for our Sudafed, that's your prototype again. There is a quick onset there of 30 minutes. And it peaks within 1 to 2 hours. The half-life is 4 to 8 hours, which is fairly long considering. But anyway, it's metabolized in the liver and excreted in the kidneys. So it works on directly on adrenergic receptors and indirectly by releasing norepinephrine for storage sites. Now, you're probably saying, what the heck is adrenergic receptors? Okay, so you're going to hear this word now and in the future, adrenergic, okay, because there's several drugs that work as an agonist with adrenergic receptors, and there are several drugs that work against as antagonists. But here, for this unit, we're talking about drugs that work or mimic the adrenergic receptors, okay? So let's talk a minute about what that is. So adrenergic nerves release norepinephrine as a neurotransmitter for the sympathetic nervous system, and that's what we're talking about with the adrenergic drugs and the adrenergic receptors. Now, the sympathetic nervous system activates and prepares the body for muscular activity, stress, and emergency. So it's that fight and flight part of the nervous system. And so the adrenergic drugs stimulate that adrenergic nerves directly by mimicking the action of norepinephrine, or indirectly by stimulating the release of norepinephrine. So sometimes you'll see these drugs referred to as sympathomimetics because they mimic the sympathetic nervous system. Also, you may see them referred to as adrenergic agonist. Okay, so when you see adrenergic, you should be thinking sympathetic nervous system and fight and flight and what happens there. Okay, so the way they work is they produce. Once they do their action, they produce a vasoconstriction, shrinking of the nasal mucosa membrane, and decreasing nasal congestion. So we've got congestion where we want a decongestant to unclog the congestion, if you will. Okay, so let's talk a minute about vasoconstriction. Okay, we either are vasoconstricting or vasodilating. Okay, when it's dilated, it means that vessel's open and it's clear. So vaso means vessel. So we're talking about the blood vessels, and that can be, you know, the big vessels. It can be the smaller capillary vessels. Okay. But vaso means vessel, and constriction means we're narrowing the inside of that vessel, okay? And that helps to stop the, the congestion from building up, okay? And the secretions from building up. So that's how that kind of works. Now, the indication for this medicine is that it provides temporary relief of symptoms related to allergies, cold, and sinuses. And for this medicine, it is okay to use with liver impaired, but there may be a dose adjustment if a person has renal impairment. So we're going to be checking out those lab studies that have to do with the renal functioning, and we're going to also be checking how much is the patient taking in as far as drinking, and we refer that as intake. How much are they taking in as far as drinking liquids, and then how much are they putting out? So we refer to that as output. So intake and output. So we're going to monitor that over a given period of time to make sure that the patient's renal function is what it's supposed to be. So therapeutically, these drugs are used not only to help with these minor things, and I refer to them as minor things because these drugs are also used to help with some very, very, very serious things. And that is life-threatening disorders such as asthma, bronchial asthma, shock, cardiac arrest, and anaphylactic allergic reactions. So these class of drugs are very, very important. It talks about in your book about over-the-counter cough and cold products should be avoided in children under 2 years of age, and for our older adult will need to get a good medical history because of contraindications and adverse effects. Critical illness, again, I told you about these drugs can be used for cardiac arrest and asthma attack and those kinds of things. So you may see them done then. There are several drug-drug interactions and medical history is needed. We also have central nervous system stimulation that goes on with this drug. And so we have to caution the use of this with anybody that has a history of seizure disorders. And then home care, we're going to have to do teaching for the patient about signs and symptoms of adverse effects, any kind of drug-drug interactions, that kind of thing. So now our adverse effects for this. Now I want to point out, your book says, as an adverse effect, it says hypotension, but I think that is a misprint. It should be hypertension. Dysrhythmias, meaning heart rhythms that are abnormal instead of our normal cardiac heart rhythm. A person can have palpitations or a really fast heart rate when they take these medicines, so we refer to that as dysrhythmias. Tachydysrhythmias, if you will. Tachycardia is an elevated pulse, and so they can, where their heart's just flying away with them. Impaired coordination, dizziness, excitability, headache, insomnia, restlessness, seizures, vertigo, meaning dizziness, dysuria, meaning difficulty in urinating, urinary retention, where a person needs to pee but they can't pee, and thrombocytopenia, which is kind of crazy. You would think, why in the world would this medicine cause a problem with that? Let me tell you what thrombocytopenia is. That is thrombocytes. Thrombocytes are your platelets. Okay, so let's break the word down. Thrombo, so we're dealing with our platelets. Cyte is cells. Penia means a decrease. Okay, so it can lower your platelet count, which is not good. Our platelets are there to help with clotting and that kind of thing. So when we don't have enough platelets, we have a high risk for bleeding. And so that puts our patients at risk. So we would want to make sure our patient has a good platelet count if they were started on this medication. Other adverse effects: blurred vision, tinnitus is ringing of the ears, chest tightness, dry nose, nasal congestion, and wheezing. Now this medicine, so I want you to think about again how it works. It causes vasoconstriction. So it's contraindicated in patients who have severe hypertension, because if with hypertension, high blood pressure, the vessels already have problems, okay? Many times the hypertension is because of vasoconstriction. So we don't need to give to somebody who's already got a vasoconstrictive situation going on, causing severe hypertension, additional vasoconstricting medicines. CAD is coronary artery disease. Okay, same thing. Coronary artery disease is heart disease, and they too, with that diagnosis, they have issues, plaque buildup in the vessels, which makes it the vessels already having a problem, and the blood flow not being what it should. So do we need to constrict a vessel that's already got blood flow problems because of plaque buildup, an additional vasoconstricting medicine? No. So, coronary artery disease, severe hypertension, narrow angle glaucoma. Again, the problems with the eyes here, vessels in the eyes, so we don't want to cause issues with that. Also, it's contraindicated with antidepressant, the MOA inhibitors, monoamine oxidase inhibitors. These are common antidepressants that are used. So what are we going to need to look at here, folks, with these patients? We're going to need to look at their medical history. We're going to also need to look at the current meds that they are on. Again, looking at that medication reconciliation. So we will know that. Okay, caution in cardiac dysrhythmias, hyperthyroidism. Okay, so what that is that's where the metabolic system in the body, the thyroid, controls our metabolism. Okay, if it's hyper, that means we got a high metabolism thing going on. And what are the adverse effects here of these medicines? It increases everything, causes excitability and that kind of thing. So we don't need to, or we need to be careful about giving it to patients with hyperthyroidism, because we're going to make them be even more excitability, even more restless, even more, that kind of thing. Diabetics need to be careful with these meds. BPH is benign prostatic hypertrophy, meaning the prostate in the male is enlarged. Hypertrophy means enlarged. And so we got to be careful with that, because these folks have issues with urinating because the prostate is enlarged. And so if we vasoconstrict that area, they're going to even have more problems with that. So we've got to be careful about that and watch about that. And then also caution with the history in seizure disorders. Okay, our nursing implications then is we want to prevent interactions, drug-drug interactions, and those are listed in your book. We want to also assess for therapeutic effects. Is air congestion better? Are we breathing better? We want to assess for adverse effects. Are they, experiencing any hypertension or, dizziness or vertigo or problems urinating, problems with their platelet count, dysrhythmias, those kinds of things. Always we got to teach. So you have specific teaching in your text in the box 29.2. We always got to teach. So really pay attention to that teaching there. The use of other forms, there are topical like nose sprays that can be used, but we do have to be careful about that. The nasal rebound nasal congestion, what that is where, okay, so we got some nasal congestion going on, and we're going to use a decongestant nose spray to get rid of that. So we do this a couple of squirts, and then a couple hours later it's we don't think it's good enough. We do some more squirts, and then we keep on like that for 2 or 3 days instead of following what's prescribed or how it's recommended to take the medicine. The patient will get what they call a rebound nasal congestion, where between doses of the medicine that's supposed to be given, the congestion comes back, and so we have a shorter and shorter time period where that congestion's coming back, and it's like the medicine's not working. So more is not better in this situation. Okay, need to teach the patients, do it as it's recommended. Also, the nasal type is safer to use with cardiovascular disease due to little systemic effects, but you still need to monitor for adverse effects with respect to the cardiovascular system. So got a question. Sympathomiminic drugs are used to relieve nasal obstruction and discharge. And the answer is true. So they can help relieve that. They're often called decongestants. Okay, now let's talk about our antitussives. The medication that is the prototype is dextromethorphan, and it suppresses a dry, hacking, non-productive cough. Now, these can have narcotics in them, or they can be non-narcotic. If it's narcotic, you know those would have to be prescribed by a doctor. The non-narcotic you can buy over the counter. And a lot of those they'll have with medications. You probably have gotten some before. They'll have DM at the end of them, and that means that's the dextromethorphan in it. Locally acting medications, you can get the throat lozenges or cough drops. Okay, so the pharmacokinetics, the way that works is it absorbs very fast. It does have that first pass effect, so remember that. That goes, when you take it, it first must go through to the liver to get a first pass effect, and then it starts to work. So the duration and action is around 3 to 5 hours. Half-life is 1 to 4 hours. Food does affect the absorption, and the majority of the drug and metabolites of this medicine are excreted in the urine. The action is that it depresses the cough center in the medulla oblongata, or the cough receptors in the throat, trachea, and lungs. So again, the use is for dry hacking, non-productive cough. It's also been found to be useful in a diabetic neuropathy pain, which is nerve pain for diabetics. It is supposed to be avoided to be used in children due to the adverse effects. And of course, the adverse effects is nausea, drowsiness, rash, difficulty breathing. Overdosing can cause hallucinations and disassociation, so that's why we got to be careful, especially with the kids. And then it is contraindicated with allergic reaction, an allergy to it, a hypersensitive to it, and atopic children. Atopic children refer to a type of skin disorder, dermatitis. So we want to prevent interactions, drug-drug interactions, and that's in your book. And it mentions about serotonin syndrome, that certain drugs with these medicines can cause a serotonin syndrome, but it doesn't go into what that is. And anytime you see a drug causing any kind of syndrome, you need to be sure to know about that, okay? And you'll see this from time to time, this serotonin syndrome, due to a drug-drug reaction. And what it does is it causes too much serotonin. That's chemicals within the body and in the nerve cell. And so it again happens when two drugs affect the body's level of serotonin and when they're taken at the same time, and it can cause too much of a release of serotonin, and it can be a dangerous situation. The signs and symptoms are agitation and restlessness, diarrhea, fast heart rate and high blood pressure, hallucinations, and increased body temperature in these individuals, overactive reflexes, and rapid changes in that blood pressure and vomiting. So that's a serious thing that needs to be addressed by physicians. Also, alcohol can increase CNS depression if taken with this, so we need to avoid that. Administering it, avoid food and drinking for 30 minutes. And of course, for the lozenges, we got to watch about children because they can, suffocate on those. We have to assess for therapeutic effects, and so this is given for a cough. So we want to see a decrease in that cough. And adverse effects, again, we don't, you know, cough, we got to think about it. Cough is a protective reflex. When we're coughing, that means something's in there and it needs to get out a lot of times. And so it is a protective reflex. So we don't want to excessively depress that cough reflex. Be sure to take a look at your teaching on in the box 29.2. It gives a generalized teaching, and then it does go into specifics here. Now, the benzonate is a type of antitussive that is the coolest thing. They look like little pearls, and I've got a picture here for you in a minute. But they numb the stretch receptors in the respiratory tract and decrease the coughing. The thing about these medicines is that you cannot break them because they have liquid in them, so they got to be swallowed whole. We also have medications that, again, have narcotics in it, codeine and hydrocodone. So anytime we're dealing with narcotics, we always have to do special teaching with patients about, this can cause a depression in your central nervous system. It can make you drowsy. The possibility of drug dependence. It can cause itching. So we got to be careful with any kind of driving or doing anything, where they're trying to, big machinery, mowing, that kind of thing. They need to be careful about all of that. Okay, this is a picture of that benzonate. And again, you can see they're kind of look like they got a little liquid in there, but they got to take those whole. Okay, and then we have our expectorants, and your prototype is guaifenesin, and what it does is it helps liquefy the respiratory secretions, making it easier to cough them up, because sometimes the mucus can get very thick and difficult to cough up, so the guaifenesin does a good job with that. And you see the pharmacokinetics there. It's 4 to 6 hours for it to work. It's metabolized, excreted in the urine. The way it works is it irritates the gastric vagal receptors, stimulating that respiratory tract fluid and increasing volume and decreasing viscosity. Viscosity is the thickness of the mucus. And so the use of this is for a productive cough. You can use it for children 2 years and older. Other interventions that help, we need to teach the client about deep breathing, exercises, and coughing, purposeful coughing. Ambulation also helps because that mobilizes that stuff in the lungs. Chest physiotherapy is like where we do where we do percussions on the chest wall, and that again helps to mobilize that. And then forcing fluids, and what we mean by that is telling the patient you need to drink a lot of fluids. A lot of water is good because it helps thin out that secretion, and it also helps this medicine to work. So that's going to be important teaching for this patient. Now, one thing in mind, there are patients who are on restricted fluids, meaning that they can only take in so much fluids in a 24-hour period, and that of course would be ordered by a physician, but it's certain conditions like heart failure, any kind of renal failure. Many times those patients are on restricted fluids, so we would need to talk to the physician about that. Adverse reactions, of course, are going to be allergic reactions, so maybe a skin rash, headache, nausea, and vomiting. And it is contraindicated with allergic reactions. All medicines, if somebody says they're allergic to it, then you don't give it. Nursing implications, we have a sustained release medication. So anytime we have those, that means we don't crush those, because otherwise we're giving them a whammy dose if we do that. So again, and we got to teach the patient about increasing that water intake, assess for therapeutic effects, and we also, want to listen to their breath sounds with a stethoscope, and see if we can hear less congestion in there. We want to do the teaching, as we said again. We want to assess the cough. Is it continuing to be productive? Anytime we look at anything coming out of the body, we got to see the color and amount, all that good stuff. And then we may have to have suction equipment available too if the secretions are so much, because the secretions can clog up the airway there, and so we may have to do suctioning on the patient depending on how thick those are. Okay, mucolytics are another type of medication that's used for this, and the prototype is the acetylcysteine, and it liquefies mucus in the respiratory tract, and it is administered by nebulizer or by inhalation treatment, and it starts working immediately. So you can see the peak is 5 to 10 minutes, and action is 1 minute, so it definitely starts working quickly. It works to disrupt the disulfide bonds in the mucoprotein in the mucus, and it reduces the viscosity, the thickness of the mucus. It's an adjuvant used to help liquefy secretions, and it can also be used as an antidote to Tylenol overdose. Isn't that crazy that they found that out? But it is an antidote for acetaminophen overdose. The adverse effects: nausea, vomiting, bronchospasms, which is not a good thing. Bronchospasms are where your bronchial tubes become constricted and they start having a spasm, and then drowsiness also. Contraindication is any kind of allergy there. And then nursing implications is administering this upon rising, before meals, and at bedtime. Now, in the hospital setting, what you're going to see is the respiratory therapy department will handle giving these, but we can still administer nebulizing. You learn to do that in clinical. So if we ever have to do a breathing treatment, we call those, then you'll know how to do them. Therapeutic effects, again, we want to see that mobilized secretions and listen to those breath sounds, monitor for those adverse effects, and then, of course, always do that good teaching. Now, other medications that are used for common colds, we have the herbs that are out there: echinacea, vitamin C, and zinc gluconate. Those are common things. And cold remedies, there's lots of different ones out there that contain antihistamines and nasal decongestants as well as analgesics. Got to for sure teach the patients to be reading the labels that they medications have there. Diabetics, especially, there's lots of medicines, cold medicines that have a lot of sugar in them. Also, our hypertensive patients and cardiovascular patients, we need to be teaching them about avoiding those medications, the adrenergic medications, so they won't have further problems. So, our nursing process for this whole unit, we're going to assess the nasal congestion and drainage. Again, we're going to look at that color, amount, and thickness. We're going to assess the respirations. We do that by counting those in a minute, and you'll learn to do that in your skills class. We're going to pay attention to the airway. Is the patient able to get those secretions up? And again, sometimes those secretions, the mucus can be so thick that it can literally, block the airway. So, that's especially important to have the suction equipment available there. Um, Again, the secretions, we're going to look at the color and the amount and the viscosity, the thickness of it, and any odor. We want to definitely check that past medical history, current medical history, the fluid intake and output, what's their hydration status, and what are their medicines that they are on, the med list. A nursing diagnosis, people with colds, they can have impaired comfort. They are at risk for injury due to medication adverse effects, possibility of non-compliance here, and also knowledge deficit. And our goal is to educate, to relieve symptoms, and that the patient doesn't have any injury related to the drug use, and that we don't have any reinfection or spread to others. Assessing interventions are going to include assessing for therapeutic effects as well as adverse effects and drug effects. Administer it safely, so knowing about the drug and how to properly administer it. Treat excessive respiratory secretions and teach about hand washing, sneezing, coughing etiquette, and teaching about the meds, teaching about increasing fluids and maintaining nutrition. That's always important for healing. Rest and activity. Also encouraging those annual vaccinations of flu or pneumonia if it's applicable. And avoiding irritants for sure. And then, of course, we're going to do our evaluation to make sure those symptoms are indeed relieved and that they don't have any injury and that the teaching is understood. And so ways we do that, we do a return demonstration. We have the patient demonstrate, if it's like, for instance, the use of nose spray, how to properly do that, and have them verbally recite back what we teach them. And that concludes your podcast.